So these next couple slides are really the impetus for me wanting to do these videos in the first place. It's just like having the conversation with people in your own household to kind of make a plan for what would happen if someone were to get sick. So again, today, Saturday, March 28th, at this point, a lot of prevention is already happening. People have gotten a lot of messaging about kind of the best steps to take care of oneself and one's family in their home. And just by social isolation happening first kind of makes it easier to kind of then set your stake in and kind of creating a new norm now in our homes for really an indeterminate period of time. So people have talked about social distancing. The term social monogamy or trusting one other family or another friend is kind of out there in the lexicon, and we can talk more about that in question and answer later on. But washing one's hands and washing one's hands well, using hand sanitizer when out and about, and really kind of the idea of protecting the seniors and those in our community from the spread is kind of a key feature of what we want to do being in this all together. So I really see this kind of creating a perimeter at home and while you're at home. The front door and the back door are kind of your boundaries, and you kind of create that safe space in here to protect your family if no one has gotten sick already. And we're going to do that to, again, kind of flatten the curve and create the social distance norms at this point. So if you kind of think about both creating the perimeter and really kind of following the basic rules of prevention to avoid getting it in the first place, folks should be pretty safe, at least in the meantime, until things start opening up again at this period of time. So just getting in the habit, washing your hands when leaving home, washing your hands when you walk in the front door, taking hand sanitizer whenever you leave the house, and then just kind of taking your own wipes to the store if you have to kind of wash off your grocery carts. I know a lot of stores are doing that really well anyway. But there's other kind of tips of getting used to kind of wiping down high use areas around your house, because if someone were to get sick, that's going to have to become like the very, very common norm, because you want to kind of, kill off the pathogen while it's in your house, should that ever happen. So the idea of kind of like getting into those kind of sanitation habits now when nobody is sick is kind of is a good drill to kind of go through at this point. A lot of cleaning supplies are out at our local Target and King Superstore. So just know that there's some great handouts on the CDC webpage, on our Colorado Department of Public Health Environment webpage, about creating a simple bleach solution and cleaners here at home. You don't need to have expensive fancy things from the store to kind of create these sanitizers. You have the stuff hopefully at home anyway. And kind of another big piece is just, again, we've had a lot of panic buying. So when I say food stock, I mean have enough food to kind of get you through until your next buying episode. Make sure you have a working thermometer at home. Your favorite fluids, because you may very well be thirsty, or you should be forcing fluids when you get sick. And any comfort foods, soups or noodles or whatever that will sound appealing to you if you were to get sick. And then those of you on medications, I have allergy medicines that I take. Have a stock supply of that, so you might not run out kind of during the longer periods of being in home that we are. And then planning with your housemates if you're living with others is super, super key. What will happen if somebody gets sick? Having those conversations now while you're healthy, so it doesn't have to be a crisis conversation if someone were to fall ill. The common advice is to identify a sick room and a bed, hopefully with a bathroom if possible, that the ill person can kind of just convalesce in and kind of be isolated from the rest of the house and the other people in the household. That's kind of a key facet to kind of talk about and think about before. I say housemate evacuation. A lot of people have had the discussions like as a healthcare worker, if I get called into duty and have to go work at the hospital, should my wife and kids leave and go somewhere else or get a VRBO to go stay in? If it calms the nerves, you might consider it, but you don't need to do that. It's not a necessary thing, because again, with kind of like the sanitation plan and kind of having the isolation plan within your house, if you're able to do that, you should be able to get by and not spread to others. It's important to remember that spreading to others within a household is kind of like the most common way of it being spread from one person to another. And then a last piece is knowing where your closest hospital or emergency room is in case someone needed to take you. We have a great 911 and ambulance care system here. They're also very busy these days as well, so it might be just as quick to have a loved one take you in their vehicle to the nearest ER if the respiratory distress happens pretty quick. Do have a mask ready and put that on before you leave your room or your house, again, to kind of control the spread even if it's not perfect. And then be thoughtful about self-care and routine. There's been a lot of great advice about that the last couple weeks, even since before stay-at-home orders happened. There's a lot of good resources out there online, especially talking to children that might be in the home. There's a little bit less about talking with your partners, spouses, or housemates about this stuff and making a plan, but there's a lot of anxiety out there, and I think people are identifying that and talking through that. We take coffee time in the morning to kind of start out our day to kind of talk through how we're doing on a daily basis, and then keeping the routine with the kids is a pretty #1 thing as well. I do want to make a quick note. A lot of my research is with homeless populations and folks experiencing homelessness in our communities, and I just want us to be sensitive and do think about those people as well when we say stay at home or keep yourself and your loved ones within a home safe. Just remember and take pause to think about those who don't have a home to stay in and go to.